Good evening to our fellow members of our team. My name is Yong Kian Kun. My matric number is JK/14332/22. For our topic discussion tonight, we would like to have a discourse on our topic of health, more specifically, public health. Later, our group members will be further discussing other topics pertaining to public health, including economics of public health, the role of government in public health, the role of public in public health, and so on. The topic of public health is our topic of interest because of the COVID-19 pandemic still grips part of the globe, with the virus threatening a swift comeback. So, what is public health? The very definition of public health is a science of protecting and improving the health of people and their communities. This work is achieved by promoting healthy lifestyles, researching disease and injury prevention, detecting, preventing, and responding to infectious disease. So, what's the aim of public health? Public health contributes to the reducing of ill health and improving people's health and well-being through health protection, means action for clean air, water and food, infectious disease control, protection against environmental health hazards, chemical incidents, and so on. So in order to maintain public health, health indicators should be monitored and healthy behavior should be promoted. Common public health initiatives including hand washing campaign, child vaccination campaign, promoting ventilation and improving air quality, suicide prevention, obesity education, and increasing healthcare accessibility and to control sexual transmitted diseases. So, healthcare in Malaysia is primarily under the Ministry of Health. Malaysia generally has an adept and extensive whole health management operating on a two-level health management structure, including a socialized, government-based, and a contemporary private healthcare method. Hence, the private healthcare management plays a part in providing professional aid that complements the worldwide health management. So, our next speaker, Chianis, will talk about the economics of public health. So, Chianis.
Thank you, Mr. Yong. My name is Khairul Anis Jaslinda binti Abdul Jalil. My matric number is JK14316/22. Regarding of economic of public health in Malaysia, as we all know, the government announced an allocation of RM 36.1 billion for the Ministry of Health MOH through the presentation of the 2023 budget in the Dewan Rakyat on 17 October 2022. At that time, Finance Minister Tengku Datuk Seri Zafrul Tengku Abdul Aziz said the RM 4.9 billion is to increase the capacity of public health services with a 12% increase compared to 2022, which is RM 4 billion. A total of RM 1.8 billion is allocated to build hospitals, clinics, and new facilities, as well for the procurement of medical equipment. RM 420 million to repair poor hospital and clinics and replace obsolete equipment. The large allocation to the Ministry of Health is a recognition of the importance of healthcare, in line with the aspiration of the health and well-being of Malaysian families, a government priority. In general, Truth of Health focuses on strengthening the health and wellness program, improving and refurbishing health facilities, increase the effectiveness of health treatment, and replacing critical and obsolete medical sets. Next topic is role of government in public health, and the speaker is Ms. Zhu.
Thank you, Ms. Anis. My name is Ezurina binti Ngaduan with a metric number JK/14233/22. I would like to speak about role of government in public health. The biggest health concern at the turn of the 20th century was the spread of infectious disease. Local government respond by implementing services so communities could have access to clean drinking water, sewage, and waste disposal. This led to a sharp reduction in disease across WA. Today, that role is shifting and we are facing a new reality. Changes to the way we live, work, and play have brought new health challenges. Chronic illness is now a leading cause of death, with obesity being a key contributor, and local governments of today and having an bigger impact on the health and well-being of the community. There are a lot of ways local government can create neighborhoods that support healthy lifestyles and help to improve the lives. For example, designing neighborhoods that make it easier for people to get to place, buy food or bike, making it easier to access affordable fruits and vegetables, creating green streetscapes by planting trees along footpaths to encourage people to walk around the local neighborhood, creating vibrant places that offer a sense of belonging, culture, and spirits, such as a sporting, community art festival, and markets. Enforcing legislation and promoting programs designed to protect people from environmental health risks, make sure the community is safe and injuries are prevented by providing lighting for street and public space, designing safe footpaths, roads, and intersections, and making sure playgrounds have seating, drinking fountains, and lots of shade. Partnering with key agencies and community members that are already working to influence the health of local community, so everyone is involved in helping to create positive changes. Developing council policies to address key public health issues, including alcohol and drug management and the design of the built environment. Planning for the health of community and putting a health lens over the activities of local government will help to create communities where people don't just survive but thrive for now and into the future. This is why it is important for both the state and local government to plan for the health and well-being of community. Thank you. That is my point. Go to my friends later. Please, Mr. Azuna.
Okay, thank you, Ms. Azurina. First of all, I want to introduce myself. I'm Muhammad Azuna bin Muhammad Sabri. My metric number JK/14263/22. The next point is role of people in public health. As we know, People Foundation is about physical and mental. For example, people need fresh air, clean water, and also nutrition food. This basic allows us to be healthier by avoiding hunger, exhausting, disease, and also injury. So, as a people in our community, we need us ourselves, like what hazards are most likely and what evacuation from the hazard and what may affect to the community. How will we get alert and warning? Also, does our community have a plan and what is the plan? Also, we should ask ourselves if emergency happen, we already have emergency contact number or not. In public health, it started from individual itself. Individual responsible to their own body and at the same time to benefit of the public health. Everyone need to improve health and prevent disease. This is because most of the danger treating people and community come from environment. So individual need to make sure the environment at home or working place always clean and in good condition to prevent disease from spreading to our community. Lastly, role of people is to follow any instruction from our government. For example, take the vaccination from baby or latest COVID vaccine to improve our antibody and protect ourselves, also people in our community from diseases. For remember, we have responsibility to each other in our community to control and stop diseases from spreading. Okay, that's all my point. I will pass to the next speaker, Mr. Thank you.
Okay, thank you to Mr. Azuna. Okay, let me introduce myself. My name is Muhammad Hidram bin Abu Bakar and my matric number JK/14252/22. My part is role of global organization in public health, or we can call it WHO. What does the World Health Organization do? Today, the WHO monitors and coordinates activities concerning many health-related issues, including genetically modified food, climate change, tobacco, and drug use, and road safety. The WHO is also an attribute of norms and best practices. Since 1977, the organization has maintained a list of essential medicine. It's encouraged hospitals to stock. It has since made a similar list of diagnostic tests. The agency also provides guidance on priority medical devices, such as ventilation and X-ray and ultrasound machine. Some of WHO most lauded successes include its child vaccination program, which contributed to the eradication of smallpox in 1979 and 99% reduction in polio infection in recent decades, and its leadership during the 2003 several acute respiratory syndrome SARS epidemic. The agency has the exclusive authorities to declare global health emergencies, which it has done several times since its member grant it the power in 2007. At present, the WHO includes combating the COVID-19 pandemic and other emergencies, as well as promoting refugees' health. I will pass to Mr. Nur Shahiman to conclude the last part. Okay, thank you.
Thank you to Mr. Idram and to my fellow friends. My name is Nur Shahiman bin Nasir. My matric number is JK/143/22. I would like to end our discussion about public health. In future, public health is indeed very important to prevent problems from happening and recurring. If we refer again to CDC Foundation statement, public health is the science of protecting and improving the health of people and their community. So, in this matter, socialized public health definitely holding a higher priority, as it is obviously supporting the main purpose of public health, which is an approach to prevent disease, prolonging life, and promoting health. As socialized public health directing towards more to ensuring access to healthcare, as it is seen as fundamental human right. While privatized public health, on the other hand, won't be much better solution towards public health, as it seems focused and towards the public especially. Sure, there is no research on saying which is better. However, privatized public health has limited benefit on the overall improvement in the health of people. It does not only make health service more expensive, but also decrease the fairness or justice and also the reliability in the supply of service. As privatized public health being the opposite of public health main purpose, we can agree that socialized public health definitely needs to be pushed forward to achieve public health real goal and is a better solution overall. That's all from my group team brief. Thank you.
Okay, so this is our discussion for tonight. Thank you all, and thank you to our doctor. Okay, so thank you very much, everybody.
Thank you.
Thank you.